We start with new developments tonight in the urgent fight against Ebola here in America. The second nurse to be diagnosed with the deadly disease is now in isolation in Atlanta being treated. Federal health officials now confirm the 29-year-old did call the CDC several times and got approval to fly to Ohio even with a low-grade fever. Our sister station in Dallas says officials at Texas Health Presbyterian Hospital will come out and apologize tomorrow for how they have handled the Ebola cases. Good evening, I'm Sam Shane.
And I'm Christina Anderson. The CDC is scrambling tonight, and it's got a lot of explaining to do. This after approving the flight for Amber Vinson, who, along with the other infected nurse, treated the Liberian man who died of Ebola last week. Vinson was admitted to the hospital yesterday, but the night before, she was on the Frontier Airlines flight from Cleveland to Dallas. She knew she had a low-grade fever, so why was she allowed to fly? The CDC gave its answer to CBS's Dr. John LaPook.
The CDC told me that Nurse Vinson actually called them several times before getting on that plane and said that her temperature was 99.5. But the person at the CDC looked at a chart and saw that she didn't officially meet the criteria for somebody at high risk because she didn't have a fever of 100.4 or above.
That was a gap CDC officials say is now closed. Meantime, President Obama has canceled his travel plans for tomorrow to monitor the response by the U.S. And with fears of Ebola growing across the country and here in California, the State Department of Public Health is planning ahead.
Tonight we are asking what are state health officials doing to protect Californians as Ebola fears increase. CBS 13's Kelly Ryan is live at the health department in downtown Sacramento getting answers.
California health officials are trying to calm fears. They are reaching out to every hospital in the state for training with Ebola. Now, they are also opening up and activating an emergency health response center, and CBS 13 got a look inside today.
This is an emergency room, not for patients, but for Ebola coordination and response. This joint emergency operation will be the center of any state Ebola response.
There's no evidence of community spread for Ebola in this state or any other state in the United States.
Even so, state officials today let the public know they are prepared, sending infection control specialists into California communities.
Those specialists are out again all over the state working with hospitals and the nurses and the Nurses Association to make sure that those protocols are being implemented.
Officials stress the risk of Ebola in California is extremely low, but they are making sure hospitals have the training needed.
We want to make sure the hospitals know that they need to inquire about travel history, that they need to be able to isolate a patient as soon as the patient shows up.
That patient could show up at an airport first. So CBS 13 is asking, what is Sacramento International Airport doing to prevent exposure to Ebola? We found out. Airport rescue firefighters have been put on alert to watch for symptoms and investigate the travel history for any passenger who gets sick and needs medical attention.
We are in conversations with the Department of Homeland Security asking them to consider adding airports in California that have an international exposure to the list of airports that will undergo additional screening.
As soon as any traveler is identified who may be showing symptoms of Ebola, county and state health officials will be informed.
Now, officials are trying to determine if certain hospitals in the state should be designated to treat Ebola patients. But in the meantime, they want every hospital to be prepared.
All right, Kelly, thank you very much. Live for us tonight in downtown Sacramento.
Crews have cleaned that Frontier Airlines jet in question, and the airline told the LA Times tonight the plane went through a routine but thorough cleaning Monday night after it landed in Dallas. But industry experts say routine overnight cleanings only include wiping down the tray tables, vacuuming the carpet, and disinfecting the restroom. And we've learned it took the airline more than 24 hours to ground the flight after the nurse's trip on Monday. So we wanted to know, where has this flight been since Monday? We called FlightAware, a tracking company, and got the answer. The flight landed in Dallas Monday night at 8:08 local time. The next morning, it flew from Dallas back to Cleveland. Tuesday afternoon, it flew from Cleveland to Hollywood International in Fort Lauderdale. Then early that evening, it flew from Fort Lauderdale back to Cleveland. Tuesday night, it went from Cleveland to Hartsfield-Jackson in Atlanta. And late last night, it left Atlanta and returned to Cleveland. Now, FlightAware looked into the plane records and found typically 2 pilots and 4 flight attendants staff that plane. Up to 168 passengers can fly on board, and Frontier does not fly in or out of Sacramento.
A small Caribbean island is now banning travelers from 3 West African nations. The leader of St. Lucia issued an order. It prohibits visitors from Ebola-stricken Guinea, Liberia, and Sierra Leone. The ban will stay in place until the outbreak is under control. So how easy